Now we will consider the muscles which move the forearm, that means produce pronation and supination. Pronator teres and pronator quadratus. And supination, which is biceps, inflexed elbow, and triceps, and supinator in extended elbow. So the pronator teres arises from all muscles that arise from the medial epicondyle arise, which is called as the common flexor origin, arise from common flexor origin, antebrachial fascia, and intermuscular septum. So this is the common origin of all muscles which lie on the anterior aspect or flexor aspect of the forearm. So we have already inserted the brachialis here and the biceps to the radial tuberosity, which is giving an epineurosis under which passes the median nerve and the brachial artery. This epineurosis must be divided in case of acute Bachmann's ischemia of the limb. This is the bicipital epineurosis under which lies the nerve and the artery, and which must be divided in the fasciotomy to relieve pressure on the blood vessels, the brachial artery and the median nerve. So after this, we will place the muscles which arise from the medial epicondyle, common flexor origin, antebrachial fascia, intermuscular septum, arise either from only the humerus, they are flexor carpi radialis and palmaris longus. So the flexor carpi radialis inserts on the second and third metacarpal. So this is the flexor carpi radialis, and the palmaris longus inserts on the palmar epineurosis, which goes and connects to the fibrous flexor sheath of all the fingers. So this inserts into the palmaris longus, inserts into the palmar epineurosis, this palmar epineurosis, and it is responsible for flexing the wrist with a cupped hand. So these are the origins from only the humerus. Then from humerus and ulna. From the humerus and ulna arise the pronator teres inserted onto the radial side and arising from the common flexor origin and the coronoid process. So it has a humeral pronator teres. It has got a humeral and a ulnar head, and between the two heads passes the median nerve, and under the two heads passes the ulnar artery. So these heads need to be released in operating for chronic Walkman's ischemic contracture, and these nerve and this artery has to be saved. So one is humerus and ulna is pronator teres. The second is flexor carpi ulnaris. So flexor carpi ulnaris, I'll have to draw a this is the medial epicondyle here, and you are seeing the trochlea, and this is the coronoid process and the olecranon process. And from the medial epicondyle to the olecranon process is attached the posterior part of the ulnar collateral ligament. To the coronoid is attached the anterior part, and you have some fibers like this also forming a triangle. Now, the flexor digitorum profundus would arise from the ulna here. This is the flexor digitorum profundus, or FDP. And from the medial epicondyle, posterior part of ulnar collateral ligament, posterior border of the 1/4 of the posterior border of the ulna, and an epineurosis common to the flexor carpi ulnaris. This is the flexor carpi ulnaris muscle. This is the flexor carpi ulnaris muscle. And so this is from the medial epicondyle, posterior part of ulnar collateral ligament, olecranon process, upper 1/4 of posterior border of ulna, and epineurosis common to FCU, extensor carpi ulnaris, and flexor digitorum profundus. So this is the origin of flexor carpi ulnaris, and I'll repeat: common flexor origin, antebrachial fascia, intermuscular septum, posterior part ulnar collateral ligament, olecranon, upper 1/4 posterior border ulna, and epineurosis common to flexor carpi ulnaris, extensor carpi ulnaris, and flexor digitorum profundus. This is the longest list of origin of any muscle, and if you can really state it, then you win a lot of numbers, lot of marks. So those are the two, the pronator teres from medial epicondyle and coronoid, and flexor carpi ulnaris basically from the common flexor origin and the olecranon. Then there are muscles which originate from the humerus, ulna, and radius. So first we had said humerus only, then humerus and ulna, and now humerus plus ulna and radius. The muscle is originates from the medial epicondyle, from the coronoid, and from the supinator crest. This is the flexor digitorum superficialis. So, common flexor origin, antebrachial fascia, intermuscular septum, coronoid process, and the supinator crest of the radius. The supinator crest starts from the radial tuberosity and becomes the anterior border of the radius in the lower part. If I try to make it a little big, you will see it this way, that if this is the ulna and this is the radius, here is the radial tuberosity and here is the supinator crest, then the muscle will arise from the common flexor origin, get some fibers from the coronoid. This will form the ulnar side and then the supinator crest from this side. So there are two heads, and between the two heads passes the median nerve. So this is the flexor digitorum profundus muscle. Okay. Then from radius, ulna to radius, you have a muscle here, pronator quadratus. From radius and interosseous membrane, you have the flexor pollicis longus. From ulna and interosseous membrane, you have the flexor digitorum profundus. So I will again summarize the origin of all the muscles on the flexor aspect of the forearm. Humerus, palmaris longus and flexor carpi radialis. Humerus plus ulna, flexor carpi ulnaris and pronator teres. Humerus plus ulna plus interosseous membrane plus radius. F flexor digitorum superficialis, radius and interosseous membrane, flexor pollicis longus, and ulna and interosseous membrane, flexor digitorum profundus. And from ulna to radius, pronator quadratus. So this is the origin of all the muscles of the flexor compartment of forearm. Now we'll see the insertion. There is a muscle which arises from the posterior border of ulna, travels around the radius and gets inserted onto the supinator crest. This is the supinator muscle. Arises not only from the posterior border of ulna, but the superficial fibers arise from the posterior aspect of the medial epicondyle also. So this is the supinator. Then you have the pronator teres inserted on the lateral border of the radius. You have the pronator quadratus arising from the ulna inserted on the radius, moving the radius around the head of the ulna. So this supinator and pronator quadratus are the deepest muscles, and then from the radius and interosseous membrane you have the flexor pollicis longus, which goes and gets inserted into the distal phalanx of the thumb. Flexor pollicis longus flexes the IP joint, interphalangeal joint of the thumb. So this is the flexor pollicis longus, and from ulna and interosseous membrane you have the origin of the flexor digitorum profundus, which goes like this, and it splits like this and is inserted into the intermediate phalanx of all fingers. So it flexes the PIP joint. Flexor digitorum profundus, would flex the DIP joint. It gets inserted into the distal phalanx. It flexes the DIP joint, distal interphalangeal joint. So this is the FPL, flexor pollicis longus and flexor digitorum profundus, which is the deepest muscle in the flexor compartment. Now above this you have the flexor digitorum superficialis, arising from the common flexor origin, coronoid process, and from the supinator crest. And this is the muscle. Superficialis comes like this, splits into two. Profundus goes and gets inserted into the distal phalanx, and this gets inserted into the intermediate phalanx. So this is the intermediate phalanx, and this is the distal phalanx, and nothing is inserted into the proximal phalanx. So FDS flexes the PIP joint and FDP flexes the DIP joint. Now after this you have 5 muscles in the superficial most layer. One is pronator teres. We have covered pronator teres. The second is flexor carpi radialis, inserted into the second and third metacarpal. Flexor carpi radialis. The third is palmaris longus, and the fourth is flexor carpi ulnaris, which is inserted onto the pisiform bone, sends a pisiohamate ligament under which passes the deep branch of the ulnar nerve, and this canal is called as the Guyen's canal. And in leprosy, this is where the nerve is compressed, and it paralyzes the abductor digiti minimi, the flexor digiti minimi, the opponens digiti minimi, all the interossei, third and fourth lumbricals, and adductor pollicis. So this pressure in the Guyen's canal, we'll draw it again. We'll enlarge it. We'll enlarge this, and we'll draw the insertion of the flexor carpi ulnaris into the pisiform, sending a part into the so this is the flexor carpi ulnaris, inserted on the pisiform, sending a ligament, and the muscles here are the nerve. We'll pass the nerve here. Here, coming like this, giving 5 centimeters above wrist a palmar carpal branch, supplying the hypothenar eminence and palmaris brevis, then passing medial to the pisiform bone, dividing into a superficial branch which supplies 1.5 fingers and communicates with superficial branch of median nerve. So this is that superficial branch. The other would pass around the pisiform under this ligament, pisiohamate ligament, supply abductor digiti minimi, flexor digiti minimi, opponens digiti minimi, opponens is inserted here, it rotates the metacarpal. So flexor, abductor, flexor and opponens digiti minimi. Then all intraossei, which are the pad dab muscles, palmar intraossei adductors and dorsal intraossei are abductors. Third, fourth lumbricals, which are the muscles which flex the MP joint and extend the PIP and DIP joint, which is called as the intrinsic plus position. If you reverse the intrinsic plus position, you will get MP joint extension and PIP DIP flexion, which is the claw hand. So you get a claw hand because this nerve is paralyzed, and it ends in the transverse head of adductor pollicis. So adductor pollicis arises from the third metacarpal and adducts the thumb. So this is the ulnar nerve passing through the pisiohamate ligament, under the pisiohamate ligament, which is called as the Goyen's canal, and which needs to be decompressed in leprosy to save this paralysis. So we have basically talked about the origin, insertion and action of all the muscles on the flexor aspect of forearm. We will name them once again. Pronator teres, common flexor origin and the coronoid process, ulnar head, inserted onto the radial tuberosity, pronates the forearm, then pronator quadratus, pronate, both pronate. Then we have the flexor carpi radialis, inserted onto the second and third metacarpal, flexing the wrist and radially deviating the wrist. Then we have the palmaris longus, flexing the attached to the palmar aponeurosis, flexing the hand in the cupped position. And then we have the flexor carpi ulnaris. You have heard, which flexes the wrist, but the much more important part is that the pissiohamate ligament makes a Guine's canal through which passes the deep part of the ulnar nerve, which gets involved in leprosy and paralyzes the abductor, flexor and opponents of the digiti minimi, all introssei, third, fourth lumbricals and adductor pollicis. So these are the superficial. The intermediate is flexor digitorum superficialis. The deep from radius and interosseous membrane is flexor pollicis longus. And from ulna and interosseous membrane is flexor digitorum profundus. Then we have also been able to place the supinator and the pronator quadratus. And we have also been able to show you the supinator crest, where the supinator is inserted and flexor digitorum superficialis radial head takes origin. So these are the muscles on the flexor aspect of forearm. Their origin, insertion. The nerve supply is that the flexor carpi ulnaris and medial half of flexor digitorum profundus is supplied by the ulnar nerve. All the rest are supplied by the median nerve. And action, now I hope you would be able to understand the action.